Prior to the start of lipoaspirate processing, all contents within the procedure pack should be opened within the sterile field. The donor site should be prepared following sterile and aseptic technique. A sterile drape is provided to isolate the donor site. Anesthetize the donor puncture site with the 25-gauge needle provided. Create a puncture hole through the skin only using the 18-gauge needle. This opening provides an access point for the lipoaspiration cannulas. Fill a 20 milliliter syringe with tumescent anesthetic fluid and attach the multiport infiltrator cannula. Insert the cannula through the skin puncture site, entering the subdermal fat layer. The cannula should perforate and remain below scarpus fascia in the abdomen. Pass the infiltrator cannula in a horizontal manner within the fat deposit, creating a spokes-on-the-wheel pattern. Slowly inject tumescent fluid during both entry and withdrawal strokes. It is important to evenly distribute the tumescent fluid during injection and avoid pooling of fluid within the donor site. Pooling of fluid will prevent adequate suspension of adipose tissue and result in collection of less adipose tissue upon harvesting. As a general guideline for small volume liposuction, at least 1 milliliter of tumescent fluid should be injected for every 1 milliliter of lipoaspirate to be collected. Once distribution of the tumescent fluid is complete, a pre-tunneling step should be undertaken prior to harvesting. During pre-tunneling, multiple passes are made with the infiltrator cannula through the donor area in the same spokes-on-the-wheel pattern. This step helps evenly distribute the local anesthetic fluid and more effectively suspends the adipose tissue. After pre-tunneling, the donor site is ready for harvesting. Attach the harvesting cannula to a 20 milliliter collection syringe and insert into the donor site. Once inserted, apply vacuum pressure by extending the syringe plunger using a syringe locking device such as the Johnny Snap provided with the kit. Aspirate adipose tissue by passing the harvesting cannula in a forward and back motion on the same plane and direction as used during pre-tunneling. Once the first collection syringe is filled, repeat as necessary with additional syringes until the desired amount of lipoaspirate is collected. It is recommended that some extra lipoaspirate be collected during the liposuction procedure to account for any excess fluid that may be present in the sample. This will maximize the amount of adipose tissue loaded into the AdiPrep process disposable.